Imagine this, a seemingly healthy outdoor cat. Maybe one, suddenly starts having violent seizures, loses its sight, acts completely disoriented. It sounds like a medical emergency,
Oh,
really.
absolutely. It is.
And it is. What's truly strange is that this dramatic, almost overnight change is linked to a uh, bizarre summer illness that primarily strikes outdoor cats right here in North America.
It's certainly a disturbing scenario for any cat owner. And what's particularly noteworthy, as you said, is that we're not dealing with some, contagious disease spreading through the cat population.
Right.
The cause is far more specific and, frankly, quite peculiar.
Exactly. Today on the Deep Dive, we're unraveling the mystery of this condition, feline ischemic encephalopathy, or FIE.
Yeah.
We've dug through the research to bring you the essential information: what it is, what sets it in motion, how veterinarians diagnose it, and importantly, what can be done.
Sort of a roadmap through the science.
Think of this as your shortcut to understanding this rather unsettling ailment affecting some of our feline companions.
Our goal today is really to delve into the intricacies of FIE based on current veterinary science. We'll be looking at research detailing the disease's mechanisms, its telltale signs, and how it's managed by vets.
Okay, so let's get right to it. What is feline ischemic encephalopathy? Break it down for us.
Okay. In simple terms, FIE is a seasonal brain disease. We see it in outdoor cats, or, cats that have some access to the outdoors, mainly in North America.
And only certain times a year.
Exactly. Late spring, summer, early fall. The defining characteristic is its incredibly rapid onset. A cat can seem perfectly fine one day and then, bam, suddenly exhibit dramatic neurological signs.
Like what kinds of signs?
Seizures, repetitive circling, a noticeable change in their awareness. They might seem confused or unresponsive, and sometimes even total blindness. It's very sudden.
And what's the trigger for this sudden and scary change? What's actually causing it?
Okay, this is the weird part. The primary culprit is the unusual migration of a Cuterebra larva within the cat's brain.
A larva, like a fly larva.
Exactly. A botfly larva. Now, this isn't where this larva is supposed to be, obviously. When it ends up in the brain, it can lead to the formation of a blood clot thrombosis or a sudden, intense narrowing of a blood vessel, vasospasm.
Okay.
And this typically affects the middle cerebral artery. That's a crucial vessel supplying blood to a big part of the brain.
The middle cerebral artery. That sounds like it carries a lot of responsibility. Very important.
It does indeed. So when this artery's function is compromised, you get what's called ischemic necrosis.
Meaning the tissue dies.
Essentially, yes. The brain tissue is starved of oxygen and nutrients, leading to cell death. This mainly hits the cerebral cortex, the outer layer responsible for higher functions like thought, perception, movement.
Wow.
And the physical presence, the movement of the larva itself within that delicate tissue, also contributes to the damage. So it's vital for vets to distinguish FIE from other things that might look similar, other vascular issues or neurological conditions.
So how on earth does this larva even get into the brain in the first place?
Right.
It sounds like a bizarre wrong turn in its life cycle.
This is where the story gets really fascinating, if a bit gruesome. The Cuterebra larva typically gets in through the cat's nose, the nasal passage.
Shows, seriously.
Seriously. From there, it embarks on this remarkable and, well, unfortunate journey. It migrates through the cribriform plate. Think of it as a sort of sieve-like bone separating the nasal cavity from the brain.
Okay, I can picture that.
Then it moves into the olfactory bulb, which handles the sense of smell, and along the olfactory peduncle, a stalk connecting the bulb to the brain.
Stay going.
And in some cases, the larva continues migrating right into the brain tissue itself, the parenchyma, or into the subarachnoid space, that fluid-filled area between the brain and its protective membranes.
That's an unbelievable trek for such a tiny creature.
Yeah.
And how does it manage to disrupt that critical artery, the middle cerebral artery, along the way?
Well, there are a few ways it might happen. The larva's body is covered in these tiny spines.
Ouch.
Yeah. They can physically obstruct the blood flow, like a tiny burr getting stuck in a pipe. It's also thought the larva might release certain chemicals.
Like toxins.
Sort of irritants, maybe. They could irritate the blood vessel wall, causing it to clamp down suddenly. That's the vasospasm, like the pipe suddenly squeezing shut. Or the vasospasm could just be a reaction to bleeding caused by the larva literally moving through the tissues. It's messy.
So the larva itself is causing chaos.
Right. And whether the larva is still alive or has died in there, the disruption of blood supply is the key problem leading to the neurological damage.
Now, where does this Cuterebra larva normally come from. It's clearly not trying to end up in a cat's brain.
No, absolutely not. You're right. The adult Cuterebra botfly, the parent, lays its eggs near the entrances of rodent burrows, mouse holes, rabbit dens, that sort of thing.
Ah, rodents.
Yes. These eggs hatch into the first larval stage, the L1. Normally, this L1 larva would attach to the fur of a small mammal, like a mouse or rabbit, and enter its body through an opening mouth, nose, eye, even the anus. Then it migrates through the tissues and settles under the skin, usually the groin or chest, where it forms that familiar warble, that lump.
Oh, yeah, I've heard of warbles.
Right. It develops there, then eventually emerges, drops to the ground to pupate, and the cycle starts again the next spring.
So the cat is basically an accidental victim here, an unintended host.
Precisely. When a cat, especially one that likes to hunt, gets near these rodent dens, the L1 larva can attach to its fur. And instead of going into a rodent, it finds its way into the cat's nasal passage.
And takes that wrong turn.
It takes that catastrophic pathway, as some researchers call it, leading to FIE instead of just developing under the skin like it should.
That makes sense.
And it's worth noting sometimes the larva doesn't even make it to the brain. It might just embed in the nasal passage or respiratory tract, causing things like persistent sneezing or discharge.
So respiratory signs could be a clue, too.
They could be. And there have even been cases with larvae found in the eye or the back of the throat, the oropharyngeal region. Less common, but it happens.
So while the brain is the main target in FIE, this errant larva can cause trouble elsewhere, too. What other systems might be affected?
Well, the brain is primary, definitely, and rarely the spinal cord. But yeah, you can find Cuterebra larvae in other spots in cats. The skin is the classic one, like in rodents. But also nasal passage, pharynx, larynx, eye, trachea, even the chest cavity, the thorax.
Right. And this is a problem we only see in North America, right? Like cat owners in Europe or Asia don't need to worry about this specific thing.
That's correct. The geographic distribution of FIE lines up perfectly with where the Cuterebra botfly lives. You won't find this disease in places like Australia or Japan because they just don't have this particular fly.
Interesting geographical link.
It really highlights the specific ecological factors needed for this unusual condition.
Okay, so we know it's outdoor cats in North America during the warmer months.
Mm-hmm.
Are there any specific types of cats, breeds, ages, sexes that seem to be more susceptible?
It's interesting. The research hasn't really pinned down any specific breed or sex that's more likely to get FIE.
Really? No particular breed?
Nope. But when we look at age, the average is around 2 years old. The range they've seen is roughly 1 to 7 years old.
So younger adults mostly.
It suggests that, yeah, younger to middle-aged outdoor cats might be more prone, possibly because they're, more active hunters exploring those risky areas near rodent burrows.
Right. That makes sense. So a relatively young, adventurous outdoor cat in the summer in North America.
Yeah.
What are the red flags, the telltale signs that might make a cat owner or a vet suspect FIE?
The biggest one, the most striking indicator, is that sudden, almost out-of-nowhere onset of neurological signs.
The seizures and circling we talked about.
Exactly. It's also quite common for cats to have shown some upper respiratory symptoms like sneezing, maybe a runny nose 1 to 3 weeks before the neurological stuff hits.
Oh, really? Like a cold first?
Kind of. It probably reflects that initial migration of the larva inside the nasal passages before it reaches the brain.
Okay, that's a useful clue.
Definitely. The neurological signs themselves often point to a problem in the forebrain, the front part. So again, the most common are seizures, that characteristic circling, altered mental state confusion, unresponsiveness, and blindness.
Those seem pretty severe.
They are. Occasionally you might see signs affecting multiple parts of the nervous system, what we call multifocal signs, but spinal cord involvement is pretty rare.
Got it. So the sudden appearance of those major neurological problems may be preceded by some mild cold-like symptoms. What specific factors, then, increase a cat's risk of encountering this unfortunate larva?
Well, the biggest risk factor is simply being an outdoor cat, or even just having access to the outdoors.
Makes sense.
And the time of year is critical. In the northeastern U.S. and southeastern Canada, the peak is usually July, August, September.
Prime summer months.
Right. But in the southeastern U.S., you might see cases a bit earlier, maybe May and June. And as you'd guess, cats that like to hunt are at higher risk.
Because they're near the rodent dens.
Exactly. They're just more likely to be in close proximity to where those botfly larvae are hatching and waiting.
Okay, so if a veterinarian suspects FIE, What does the diagnostic process actually involve? How do they rule out other conditions that could cause similar sudden neurological issues?
Yeah, that's a crucial step. You have to differentiate FIE from other things causing acute brain events, like problems related to kidney disease causing high blood pressure, which can lead to strokes.
Right.
Head trauma is another possibility. Brain tumors, too, although they usually cause signs that get worse gradually, not suddenly, like FIE.
Fuller onset, yeah.
And then there are infectious or inflammatory diseases, things like cryptococcosis, a fungus, toxoplasmosis, a parasite, FIP, feline infectious peritonitis, or even F5V, feline immunodeficiency virus. All those need to be considered and ruled out with specific tests.
And what about standard blood tests and urine tests? Did they offer any clues?
You know, interestingly, the routine blood work and urinalysis are often surprisingly normal in cats with FIE.
Really? Nothing shows up?
Not usually anything dramatic. Sometimes the complete blood count might show a mild increase in certain white blood cells, neutrophils, maybe eosinophils, or just total leukocytes. Blood chemistry might occasionally show slightly elevated globulins or maybe blood sugar.
Not very specific then.
Not really. And importantly, tests for FeLV, FIV, FIP, crypto, toxo, those are typically negative, which helps rule those things out at least.
So while standard labs might give some context, they're not really definitive for FIE. What about imaging? Looking inside the brain, is that more helpful?
Absolutely. MRI, magnetic resonance imaging, is really considered the gold standard here. It's the most valuable tool for diagnosing FIE.
What can an MRI show?
An MRI scan can often reveal a characteristic track-like lesion. You can literally see the path the larva took, extending from the cribriform plate, that sieve-like bone again, into the olfactory bulb, and then into the lobes of the brain.
Wow, you can see the trail.
Often, yes. Especially on certain MRI sequences, it gives direct visual evidence of the migration. The MRI can also pinpoint the areas of ischemic infarction, the brain tissue damaged by lack of blood.
Okay.
And depending on when the MRI is done, the appearance changes. If it's done soon after the signs start, you might see increased signal intensity on certain images, indicating swelling and inflammation in the cortex or the area supplied by that middle cerebral artery.
And if it's done later?
If the MRI is done later, say more than 2 or 3 weeks after signs appeared, you might see evidence of gray matter loss in that affected area. And even secondary changes like hydrocephalus ex vacuo, basically. Brain tissue loss creates empty space, which fills with cerebrospinal fluid.
I see. What about CT scans? Are they useful?
CT scans are generally less sensitive. They don't provide as much detail as MRI for diagnosing FIE, so MRI is definitely preferred if available.
Okay, MRI is key.
Yeah.
What about analyzing the cerebrospinal fluid, the CSF, that surrounds the brain and spinal cord? Can a spinal tap help?
CSF analysis in FIE cases is often normal, or it might show just a mild, non-suppurative inflammation.
Meaning not a lot of pus cells.
Exactly. Not like a major bacterial infection. You might see slightly more macrophages, lymphocytes, maybe some eosinophils. So while it's not definitive on its own, CSF analysis is helpful to rule out other more aggressive inflammatory or infectious brain diseases.
Right, helps narrow it down. So it sounds like MRI is the best bet for a diagnosis while the cat is alive.
Right.
What about after the fact? If a cat sadly doesn't survive, what might a pathologist find when examining the brain?
Yeah, post-mortem examination can be very revealing. You might see localized areas where the tissue is softened. That's malacia and signs of bleeding, hemorrhage, particularly involving the olfactory bulbs and peduncles, and in slices of the brain tissue itself.
So visible damage.
Yes, and if they look really carefully around the cribriform plate, the olfactory structures, the brain, the meninges, even the overlying skull bone, they might actually find the larva itself.
Find the actual culprit.
Sometimes, yes. They're typically in the second larval stage, about 5 to 10 millimeters long, kind of tan-colored with those characteristic rings of spines.
Wow.
And microscopically, under the microscope, histopathology would show evidence of tissue death and bleeding along the larva's path, or maybe less specific things like necrosis in the outer layers of the cortex, signs of infarction, and reactive changes in the brain's supporting cells, the glia.
This paints a very clear, if somewhat disturbing picture of the physical damage this tiny parasite can inflict. Once FIE is diagnosed, what can be done to help the cat? What's the standard treatment approach?
Right, treatment. The cornerstone is really supportive care, managing the symptoms.
Like controlling the seizures.
Exactly. Cats having seizures might need hospitalization in a padded cage so they don't hurt themselves. If a cat has severe circling or balance issues, sometimes a special swivel-laggy catheter is used for fluids so they don't get tangled up.
Makes sense.
Interestingly, As long as the cat is stable enough to eat and move safely, there aren't usually specific restrictions on activity or diet, and client education is huge.
Explaining what's going on.
Yes, helping owners understand it affects outdoor cats. It's seasonal, maybe less common in very urban areas without the right rodents. Managing expectations is important.
And what about directly targeting the larva itself? Is surgery an option? Removing it.
Surgical removal from the brain or spinal cord, it's been reported, but only very, very rarely in cats. It's theoretically possible if you could pinpoint the larva very early with advanced imaging like MRI.
But not common practice.
No, definitely not routine. Brain surgery is highly invasive and risky.
So mostly supportive care. Are there medications that can help manage the neurological symptoms or even kill the larva?
Yes, supportive care almost always involves antiepileptic drugs for seizure control. Common ones are phenobarbital for longer-term management, or diazepam intravenously for severe active seizures. Levetiracetam is another option. Maintaining hydration with IV fluids is also vital, sometimes with added thiamine or potassium, depending on the cat's status.
And killing the larva. Any drugs for that?
Well, there is a sort of cocktail protocol some vets use, but it's mainly for cats diagnosed very early, like within the first week of signs.
What's in the cocktail?
It often includes an antihistamine like diphenhydramine, an antiparasitic called ivermectin, and a potent steroid like prednisolone, sodium succinate, followed by oral prednisone, and maybe an antibiotic like enrofloxacin.
Ivermectin.
Yeah,
Is that controversial sometimes?
it can be, and its use here is considered off-label, not specifically FDA approved for cutiribra in the brain, so informed owner consent is absolutely essential.
Right.
And this cocktail isn't generally recommended if the cat's been showing signs for more than a week, because the thinking is the larva is probably dead by then anyway.
I see. And are there risks with using ivermectin like that?
That's a very important point. It shouldn't be used in cats known to be sensitive to it. And while severe reactions aren't common in this specific use, there's a theoretical risk. If the larva dies suddenly, it could release a lot of foreign proteins, potentially causing a severe allergic reaction.
Something to consider.
Definitely. Dexamethasone is sometimes used as an alternative steroid to prednisone. And throughout all this, sequential neuro exams are key to monitor how the cat's doing and adjust treatment.
Okay. And what about preventing this whole ordeal in the first place? What can cat owners do, especially if their cats love going outside?
The single most effective prevention is keeping cats indoors, period, especially during those peak summer and early fall months when the botflies are active.
Indoors is safest.
By far. Some vets also suggest using monthly broad-spectrum parasite preventatives products containing things like fipronil, imidacloprid, selamectin, or even ivermectin.
Do those definitely work against this?
Well, the specific effectiveness against preventing aberrant cutiribra migration into the brain hasn't been definitively proven in large studies. It's more of a might help, probably won't hurt kind of suggestion. Reducing exposure to areas with lots of rodents is also a good idea.
So it's a serious and traumatic illness,
Yeah.
potentially devastating. What are the long-term prospects for cats that survive FIE? What happens after the initial crisis?
Yeah, the prognosis is guarded. Sadly, even with treatment, some cats might have persistent problems. Seizures that are hard to control, compulsive circling behavior, even lasting behavioral changes like becoming more aggressive.
So permanent damage is possible.
It is. However, many cats do show significant improvement after that acute phase. They can recover enough to live relatively good quality lives as pets. The extent of long-term deficits really depends on how much brain damage occurred from the lack of blood flow and the trauma from the larva itself.
So to kind of wrap up our deep dive on feline ischemic encephalopathy, it's this seasonal brain disease in North American outdoor cats caused by that accidental migration of a cutiribra larva.
Right, taking a wrong turn into the brain.
The symptoms come on suddenly, very alarming seizures, disorientation, circling, blindness often. Diagnosis leans heavily on MRI.
MRI is key, yeah. And treatment is mainly supportive care, managing those symptoms.
And crucially, as we've discussed, the best prevention, the most reliable way to protect your cat from this pretty unsettling condition.
Keep them inside, especially during summer and early fall when those flies are out laying eggs near rodent burrows.
It really highlights the intricate and, yeah, sometimes unsettling ways parasites interact with their hosts, doesn't it?
It really does. Make you think.
It makes you think about all the unseen biological dramas playing out around us all the time, and how even a tiny creature taking a wrong turn can cause such major problems.